Good evening everyone. We are group 7. We are going to present about Martha Rogers' theory of humanitarian being. Martha Rogers' theory, Science of Unitary Human Beings, is mainly focusing on the 4 concepts and 3 principles of hemodynamics that are energy field, openness, pattern, pan-dimensionality, integrality, resonance and helices. Martha Rogers' biography. She was born in Dallas, Texas, May 12, 1914, sharing her birthday with Florence Nightingale. In 1936, she attended a nursing diploma program at Knoxville General Hospital. She continued her schooling at George Peabody College and completed Bachelor's of Nursing in Public Health Nursing in 1937. After completing her Master's in Public Health Nursing from Teachers College University in 1948, she started working as a public health nurse. In 1951, she joined Johns Hopkins University, Baltimore, and completed Doctors of Science in 1954 while she was working at Catholic University. In 1963, she edited the Second Journal of Nursing Science. An introduction to the theoretical basis of nursing was the most famous work of Rogers, which was published in 1970. In 1975, she retired as the head of the Division of Nursing from the New York University. She joined Emeritus University in 1979 as a professor and continued to work on the science of unitary human beings until the time of her demise in March 13, 1994. Major concepts of Rogerian theory. All the human beings are viewed as the integral part of universe. Human beings and the environment have energy field. Nursing actions is directed towards patterning and maintaining this energy field. Human. Unitary human beings. A person is defined as an indivisible, pan-dimensional energy field identified by pattern and manifesting characteristics specific to the whole and can't be predicted from knowledge of the parts. A person is also a unified whole having its own distinct characteristics that can't be viewed by looking at, describing or summarizing the parts. Second concept is about health. Rogers defined the health as an expression of the life process. It is the characteristic and behavior coming from the mutual simultaneous interaction of the human and environmental field, and health and illnesses are part of the same continuum. Continuation of major concepts about nursing. It is the study of unitary, irreducible, indivisible human and environmental field, people and their world. Rogers claimed that nursing exists to serve people and the safe practice of nursing depends on the nature and amount of scientific nursing knowledge the nurse brings to his or her practice. Major concept number 4, scope of nursing. Nursing aims to assist people in achieving their maximum health potential. Maintenance and promotion of health, prevention of disease, nursing diagnosis, intervention, and rehabilitation encompasses the scope of nurses' goal. Major concept number 5, environmental field. An irreducible, indivisible, pan-dimensional energy field identified by pattern and integral with the human field. Pan-dimensional is undeviating field which is not constricted by space or time. It is an infinite domain without boundary. To continue this presentation, I call my friend Rosemary. Thank you.
Hi everyone, my name is Rosemary and I'll be discussing about the fundamental ideas or assumptions of Martha Rogers' theory of unitary human being. First assumption is all about energy field. Man is a unified whole, possessing his own integrity and manifesting characteristics that are more than and different from the sum of his parts. A unitary human being is open systems, which continuously interact with environment. A person cannot be viewed as parts, it should be considered as a whole. So the energy field is the fundamental unit of both the living and the non-living. It provides a way to view people and the environment as irreducible wholes. The energy fields continuously vary in intensity, density, and extent. That is why human beings and the environment have energy field. So nursing action is directed towards patterning and maintaining these energy fields. The second assumption is about integrality. Man and environment are continuously exchanging matter and energy with one another. Human beings have the ability to adapt according to the new changes in the environment. It includes the entire energy field other than a person. These energy fields are irreducible and not limited by space and time, identified by its pattern and organization. Because of the inseparability of human beings and their environment, sequential changes in the life process are continuous revisions occurring from the interactions between human beings and their environment. Between the two entities, there is a constant mutual interaction and mutual change whereby simultaneous molding is taking place at the same time. This is the principle on which meditation and humor works to produce a positive environment. The third assumption is helicy. The life process evolves irreversibly and unidirectional along the space-time continuum. The life process of human is irreparable in one way, as an example is from birth to death. Health and illness are the continuous expression of the life process. The human environment field is a dynamic open system in which change is continuous due to the constant interchange between the human and the environment. This change is also innovative because of constant interchange. An open system is never exactly the same at any two moments. Rather, the system is continually new and different. The fourth assumption is all about pattern. Pattern and organization identify man and reflects his innovative wholeness. Pattern and organization are unifying concepts, and without them, everything would be chaos, dynamic, and ever-changing. Pattern is the distinguishing character of the energy field. Pattern appraisal is an inclusive assessment of human and environment energy fields, its organization of energy field, and identification of areas of dissonance. Patterning can be done by suggesting the various alternatives, educating, empowering, encouraging, depending on the client's condition and needs. The fifth assumption is sentient being. Sentient means finely sensitive in perception or feeling. Man is characterized by the capacity for abstraction and imagery, language and thought, sensation and emotion. Human being possesses the ability to think, imagine, sense, feel, and can use language for expression. This movement of energy fields can be made by human touch and guided imagery, activities, drawing, storytelling, and other active use of imagination. So thank you for listening. My groupmate Carmela will discuss about our case scenario.
We'll now proceed to our case study with the application of Martha Rogers' theory, Science of Unitary Human Being. Mr. C is a 54-year-old male with a history of acute chronic obstructive pulmonary disease. Went to see his doctor because he has been experiencing difficulty of breathing more often than he used to. His respirations are 32 breaths per minute and labored. He has nasal flaring and chest tightness. He states that he has a productive cough and has to clear throat first thing in the morning. It is noted he expectorates yellow tenacious mucus. He appears anxious during the assessment and states fear and apprehension about his future. He has a 28-year history of smoking 2 packs of cigarettes per day. The nursing process has three steps in Rogers' theory of unitary human being. First is pattern appraisal. It requires the identification of pattern manifestations that reflect the whole. Pattern appraisal is integral to the provision of care to unitary human beings. Second, voluntary mutual patterning. It is defined as a continuous process whereby the nurse assists the clients to freely choose with awareness ways to participate in their well-being. Third, evaluation. It is ongoing and simultaneous with appraisal and patterning. Emphasis is placed on identifying perceptions of desire for change. The areas of assessment are the total pattern of events at any given point in space-time, simultaneous states of the patient and his or her environment, rhythms of the life process, supplementary data, categorical disease entities, subsystem pathology, and pattern appraisal. Subjective data were elicited from Mr. C through specific questions. Changes in sleep patterns, sleeping for shorter periods. Changes in nutritional intake, eating less. Wife is a positive smoker with 2 indoor cats for pet. Mr. C also thinks that his wife is not amenable to get rid of cats and quit smoking. Nurse seeks to discover what is important for Mr. C, how Mr. C defines healthy. The visible rhythmical pattern is a manifestation of Mr. C's anxiety. The pattern is one of many unknowns for Mr. C and his wife. Using power as knowing participation in change to guide the care, the nurse discusses with Mr. C and his wife to answer questions and give guidance related to potential issues which may emerge. Dissonance is manifested in many aspects of Mr. C's appraisal. It is noted in the progression of the disease, in his dyspnea, anorexia, and sleep pattern disturbance. It is also noted in his relationship with his wife. It is also perceived through Mr. C's acknowledgement of fear and apprehension regarding his future. Mutual patterning for Mr. C will include sharing knowledge and offering choices, freedom and involvement in selection of modalities. Knowing participation places the patient in a position of greater power in the nurse-client relationship. Summary of client's subjective data, experiences, and how the nurse understands them. Work on the consensus for the activities that will be acceptable for Mr. C. Input from Mr. C regarding disease and how to increase the level of its comfort. Involving the patient in his care plan. Rogers suggested that people have the capacity to participate knowingly in the process of change. The next slides, which will cover goals and nursing interventions with rationale, will be discussed by my group mate Sneha Joseph.
I am Sneha Joseph. I am going to deal with the goals, nursing interventions and rationales of the theory. First goal, Mr. C will demonstrate effective breathing pattern. Second goal, client and his wife will have an increased knowledge about the disease condition. Third goal, to improve the current nutrition status. The next is to have a positive outlook towards life in the future. Mutual patterning. Mutual patterning is an important aspect in Martha Rogers' theory. Sharing knowledge and offering choices, freedom and involvement in selection of modalities, knowing the participation places the patient in a position of greater power in the nurse-client relationship. Summary of client subjective data, experiences, and how the nurse understands them is also an important aspect. Work on the consensus for activities that will be acceptable for Mr. C. Input from Mr. C regarding disease and how to increase the level of his comfort. Also, involving the patient in his care plan is important in developing a good effective therapeutic communication. Rogers suggested that people have the capacity to participate knowingly in the process of change. We will see the nursing interventions and rationales. Breathing retraining is an important intervention for the COPD patients. There are mainly two breathing exercises. One is pursed lip breathing exercise and the other is abdominal or belly breathing exercise. The second intervention is sleeping with the head of bed end elevated so that it improves the function pattern and also helps in lung expansion. The third one is progressive relaxation exercise at bedtime to promote sleep. Health teaching about the COPD to promote the compliance. Recommendations for high calorie, high protein diet to improve nutrition status as well as the meet energy requirements. The next intervention is eating small, frequent meals than having a heavy meal. Because heavy meals can cause the compression of the diaphragm, this will create discomfort in COPD patients. The non-medicinal therapeutic interventions are centering guided imagery and meditation to improve both emotional and physical health. Personal knowledge regarding treatment, oxygen therapy, medications to promote therapeutic adherence. Music therapy is an effective intervention for dyspnea and anxiety in patients with COPD. Therapeutic touch to bring energy and promote harmony. Humor to reduce anxiety and depression. Laughing therapy is not only effective for unhealthy patients but also for healthy persons to improve their health and well-being. Next portion is going to dealt by Mary Ann Velasco with the evaluation portion. Thanks.
Hi everyone, my name is Mary and I will be discussing about evaluation, basing it from our client case study. And as a recap, it was discussed a while ago that evaluation is a continuous and integral part of both manifestation, knowing appreciation, and voluntary mutual patterning. Evaluation and re-evaluation should be a continuous process since the goal is for the person to achieve actual potential, basing it from human well-being and betterment. And with the interventions that have been done to achieve our goal, the patient can now demonstrate effective coughing technique by improved breathing pattern, a proper posture and breathing technique, and a demonstration of normal respiratory rate. Second goal that have been achieved is an increased knowledge about the disease condition. Patient and wife are now more knowledgeable, and wife verbalizing that she will quit smoking and have their two indoor cats stay at their friend's house. Third is improve in nutritional status. Patient have increased appetite and weight is now close to normal. And lastly is a positive coping technique. Since there's an increased knowledge of the disease condition, the patient have reduced worry about it, hence there's less worry about the future. In conclusion, the science of unitary human being is highly generalized, since its concept and ideas are not confined to a specific nursing approach. The emphasis is more on nurses viewing client as a whole. Rogers had made us believe that the client and its environment are an integral part of each other. That is, a client cannot be separated to his or her environment when addressing health or treatment. The conceptual framework of Rogers have influenced all aspects of nursing by providing alternative to traditional approach. That's the end of our presentation. Again, we're Group 7. Thank you so much for watching.
station. My one solution is my queen, 'cause she's